Welcome to the Deepak Saini Show.
He said he gon' huff and puff and blow my mind up. You meet the island girl, she might dirty wine up.
Welcome to the Deepak Saini Show. I'd like to thank Jxxiii for the intro music. You can find a link to her music in the show description. My guest today is my good friend here, Dr. Jxxiii Gross, MD, also known as the Stem Cell Whisperer. We're going to talk about that a little bit more here. So a quick little intro here on my friend here. Polymath and great medical mind, Jxxiii Gross turned down MIT. Who turns down MIT? We'll talk about that too. I have a question about that. To attend Berkeley to study biochemistry and molecular biology before going to medical school. By the time he finished medical school, he was published multiple times in medical journals and won prestigious research awards. Dr. Gross has always pursued a path to help patients avoid surgery, focusing on neurosurgery, and with the Spine Fellowship, he's one of the thought leaders in providing the best options and highest quality of care to his patients. Therefore, it's no surprise that a number of years ago, out of frustration for patients wanting more options, he went back to his roots to basic science and retrained in regenerative and stem cell medicine. He studied the best practices around the globe and is one of the few cutting-edge scientists and doctors to offer alternatives to those seeking a different kind of help, not one pushed on them by health insurers or the government. Dr. Gross is well versed in neural networks, biocomputing, pattern recognition, and can offer his opinions on medical areas from anti-aging to biohacking to disease prevention. My good friend, welcome to the show.
Thank you for having me. This is fantastic.
Yes, so everyone can tell this is this is the first one I've done live. I am here in Vegas at Dr. Gross's office here. You may or may not have seen some of the before and afters that are going along with this podcast. You can see the poll here. I have an exosome IV. You're gonna get. I'll send a link. If this is not part of this podcast, I'm gonna send you a link to the whole procedure that we've recorded here today. So let's get started. And I really appreciate being here and meeting you in person. We've been friends for well over a year now. The first time we got to meet in person, so I'm very, very excited here. And as you can see, I do have the exosome IV. But let's get started. What got you into medicine?
Well, I probably am wired to serve others. I mean, I've always found that I was always enthralled by science, particularly the biosciences, and always went that direction. You know, taking the extra classes in high school, and then in college, it was clear I was going to go into something like that. And frankly, medical school was just sort of a stepping stone. I knew where I was headed, but you have to go through it.
Sure.
Always had that in me. As a kid, I was catching frogs and tadpoles and fish and just amazed by the biodiversity and nature, and it just led that way.
Awesome. And where did you grow up? I don't really know.
I grew up in a small town in Ohio, Lima, Ohio.
Oh, okay. I've never been there, but I've heard of it before.
If you've ever seen Glee, it was supposedly where Glee takes
now
place.
My daughter might actually watch this podcast
Exactly.
now. There's the Glee connection there. Okay, so I wasn't planning this, but why did you turn down MIT to go to Berkeley? Is it just the weather?
Berkeley, weather, just the whole package. It was
Girls?
Division One.
Girls?
They have girls, yeah.
Yeah.
Division One school with all the pageantry, sports, and that sort of stuff that I really wanted. In addition to the top-notch science, so it was. I was going to school on the East Coast for high school. All my friends were going to Ivy League and schools in that area, and I was one of the few that didn't. So it was sort of a big jump, but it was turned out to be great, amazing.
Awesome. So let's start with. So again, the audience. I'm not sure where we're going to place what we've all done already before and some of the discussion we had. This might be standalone. So let's discuss just really briefly. What do I have going on here? I have the exosome. I've already said exosomes IV. Maybe high level, what we got going on.
Sure. I mean, this is a regenerative IV. This is in the family of regenerative biologics. That includes things like PRP and stem cells, and now stem cell derived exosomes or nanoparticles. So this helps your cells flip from a defense mode or a pro-inflammatory mode to an anti-inflammatory, regenerative, restorative healing mode. Helps your cells work backwards.
Age backwards. Yeah, everyone knows I'm about reversing the effects of aging. Where do I want to go next here? So a lot of people, let's start here. What's, we've talked about this, we're talking about regenerative medicine. What is the forefront of regenerative medicine? Is this it now? What where are we at in the kind of the life cycle, if you will? First inning, second inning?
No, this is we're still really early. We're just tapping into what it does in a natural setting, right? We're putting youthful things back into an aged body and getting a youthful result. And this is sort of a small version of, the experiment where you hook up an old mice to a small mice, you exchange their blood, and the young mice behaves older and the old mice behaves younger, and the cells of those mice behave the opposite. You see the same thing if in children who donate their stem cells because they match an older person who needs a stem cell transplant. Maybe not children, but young people. And then when they donate, that younger person then takes on the behavior, the cellular activities, the lab tests of a younger person. So we are giving you a dose of youth in a way. This is just the 101 of regenerative. I mean, this doesn't even tap into the reverse programming of stem cells into what are called iPSCs, or induced pluripotent stem cells, that have all kinds of additional benefits that we haven't even fully studied yet. And if you include gene editing and the things we can do to not only help people with genetic diseases or genetic predispositions, but also enhance healthy genes, DNA repair genes, genes that are found to be associated with longevity, we're just at the first millimeter of a many mile journey.
So I kind of said first inning, second inning. We're really like the game hasn't even started yet.
We're just doing these stretches at the warm-ups.
Stretches the warm. That's a good way to put it here. So how did you get into? I kind of said your bio here, but how did you fall into regenerative medicine from what you were doing before? Maybe just really high level what you did before.
Yeah, I mean, I'm a recovering neurosurgeon. I'm spine fellowship trained. I took care of thousands of people with neck and back injuries and ailments and problems and disc issues and pinched nerves and fractures and all kinds of problems. And the vast majority of people with, we'll call them run-of-the-mill neck and back pain and disc issues, the front line is therapy and time and anti-inflammatories, and and therapy might be chiropractic or physical therapy, which we call physio, or acupuncture, various things. And then injections. And injections can be useful to help us sort out exactly where the pain's coming from and or treat the pain. But there are a vast majority where those things either don't work adequately or don't work long enough to make them a viable way to palliate the pain. And then the only thing left on the menu is surgery. And that's a big deal. And in the era of MRIs, we catch spine problems earlier than we did in the 1970s and before. Used to be, you didn't even see someone until they're, could barely move a limb. And now you get a little bit of a neck ache or back ache, and you go through the motions, you get an MRI, and we figure out what's wrong. Aha, we see something, let's try to match it up. Well, there was a great frustration both from me trying not to do a more invasive surgery in people who weren't maybe bad enough. Maybe they had ongoing annoyances and pain and couldn't do all their activities they liked, but they could still work and get out of bed and do things. There's a very large gap, and I was looking to fill that gap, and patients came in and told me how to fill it. They said, "Hey doc, what about lasers? What about stem cells?" And for a long time you listen, you go, "Well, yeah, I don't know. I've heard of that. I'm not sure. I don't know." And finally, enough I don't knows added up to, instead of going to those annual spine meetings where a lot of people pat themselves on the back for doing the same things they've done for 50 years, I said, I'm going to go to a different meeting. And I started going to the regenerative medicine meetings and taking the educational courses and reading the reads and doing the work. And it turns out there are options. They're just not mainstream. And if you weren't trained that way by someone who's trained 50 years earlier, you're not gonna pick up on what's new and different and possible. So that's how it all started.
So maybe if stem cells, probably, I don't know, you tell me how long they've been identified. Probably 50, 60 years we've known about them. But as far as like where we're at today, and again, we're in the early innings, as far as, the regenerative medicine, people doing stem cells, exosomes, like how, where are we at, 5, 10 years at most?
Well, a lot of what I do, for example, in joints, in knees and spines, is based on a lot of really great work from some European orthopedic doctors who 2 years ago published the 15-year follow-up on knees. So that was when they did the study. They'd probably been doing this 20 to 25 years. Here in North America, it's slow. So I would say, as a human race, we're probably a couple decades into this. We should be further along.
Okay. So would it be fair to say, I'm trying to extrapolate an answer here, that in kind of what we're doing today, or what, you know, what else you do, I'm not doing today, but what you do here in your clinic is maybe 10-ish years, that type of thing, or less?
You mean everywhere?
In everywhere, not just necessarily.
Yeah, I think it's going to take longer. I think the cycle of education and medicine preserves tradition over, pushing science. There are economic and political pressures that push payment or lack of payment over science. So I think that we're suppressed here. I think there are a lot of smart thinkers and people who don't, just do what's available to them from their health insurer, who will look outside the box. The early adopters here were pro athletes who left this country to go get stem cells. We're talking about football players with the last name Peyton, or golfers with the last name Woods, perhaps. These people were known to have gone out of the country, 10, 15 years ago or more to get these things. They're available here.
Yeah, I think Peyton Manning. I think so.
Yes, sorry.
Yeah. And he got 2 more years out of his career.
He had a neck surgery or two, but also benefited from some regenerative treatments. And I had actually patients 10, 15 years ago who went to Germany and came back having had stem cells. And I was intrigued at the time, but it was a little too outside the norm for me to go pursue. Well, eventually it caught up to me, and I may be at the forefront of it here in the States, but it's certainly not the forefront of what's going on in the world.
Sure. And you mentioned a couple things in the political climate. So we'll save that for round 2. We'll do a round 2 at some point on that. So can people, as everyone probably knows by now who follows me, my past health challenges I went through, including my back injury. But specifically, can people regenerate their own cartilage in their joints and and their spine? Kind of where you came from in the medical system.
They can. I mean, think about it. Your body made those cartilages and joints in the first place. We're just tapping into the original factory and putting in a new order.
Would that include your meniscus and things like that?
Yes, we have some wonderful before and after MRIs, and we're accumulating more. And once I have enough, I think I'll publish a retrospective article on it. But this is something we can see. We tap into the very stem cells in the bone marrow near those joints that produced those proteins that created that meniscus in the first place. This is exactly what the French studies showed. So we're following really great protocols.
Podcast produced by the Minted Green Company. Welcome to the Deepak Saini Show.
He said he gon' huff and blow my mind up. You meet the island girl, she might dirty wine up.
Seems to respond better. Like, is the back more challenging than, say, knees? Neck more challenging than elbows? That sort of thing.
Yeah, so, okay, this is kind of my loose observations at this point. This isn't science, this isn't proven, but I think weight-bearing joints do better because weight and gravity and pressure activates mechanoreceptors. Obviously, a word maybe not everyone's going to digest, but it's stimulators and sensors in the bone ends at the end plates that stimulate stem cell activity. So I think we get better results out of knees and things. Lower backs have been slower to respond, and I don't know exactly why, because by the time I get to them, they're pretty degenerated. I have the best results so far with my knees, not my knees, but my patient knees.
Sure.
I don't know exactly why, but knee problems are very common. The French studies based on knees, particularly the kneecap or patella. My earliest results are cartilage regeneration demonstrated behind the patella. Patella has its own cartilage and its own joint, really, with the front of the knee. The meniscus and the related ligaments are probably the more weight-bearing part of the joint. But we have early and fantastic results in the patella and great results with the meniscus. They take a little longer.
Okay. What about the ankles then? The weight bearing as well?
I've done ankles, not as many. We have some good results. They're just not enough for me to hang my hat on yet in terms of how they compare to the knees.
Sure.
Or when I do hips, I've done shoulders. It's just I don't have the comparison there as I do with knees and low backs.
Sure. And in that context of not having the comparison, how about like neck?
So it depends. We have different sources of pain from the spine. The two main sources will be a problem with your disc and the related structures, and or a problem with your joints in the back of the neck or back called the facet joints. And if you discuss one or both of those, you're encompassing the vast majority of spine problems. So the joints are relatively straightforward. There are wonderful papers and results, and I have my own set of outcomes based on injecting regenerative biologics in the joints. And I'm not the only one. There are others who have come before me in this field. The discs are a little more difficult. We have to get into the vertebral bones, the end plates, and all things considered, it's a little more difficult to get to the bones of the neck than the lower back. Because the lower back is a very straightforward injection. The neck, you have to be super cautious, lots of vascular structures and things to avoid. So I don't have the following with neck quite yet. We're working on some protocols to make that easier with some help.
So I should ask this question before these last couple, but when we're talking about great results with the knees and out everywhere, but maybe just not the data. Are we talking exosomes, what I'm doing today, stem cells, combination, kind of that can be blanketed across all of those?
It could be all of the above. My personal preference is exosomes. They are more abundant, more concentrated, they last longer, they travel further, and the results are great for half the price. Stem cells, most of the early work is done in stem cells. The French study is stem cells. And stem cells will work just fine. If I can get the same results for half the price with exosomes, we'll do it that way.
Is it more beneficial, because I've heard this, and you're the expert here, you let me know, that exosomes in combination with stem cells, doing it at the same time, one after the other, or maybe I don't know if you do it at the same time, that's even more beneficial. Obviously it'd be more cost as well. Is that even more beneficial?
It can be. There's a debate, and I've been involved in the debates with some stem cell proponents, and I'm not against stem cells in any way. The exosomes we have are from stem cells, and mixing them together, you really think about it, a stem cell preparation probably contains exosomes. Those stem cells are making exosomes. So in one thought process, the exosomes we deliver, we're just cutting out the middleman. You're cutting out the stem cells. So is there additional benefit from the stem cells? There are some scientists who say yes, that the stem cells have a certain innate intelligence to make more customized exosomes. We don't have enough knowledge to back that up yet.
Okay, so still early in the research
It is.
science. Okay, so we talked about this earlier in one of our earlier recordings, which may or may not be paired with this, might be a standalone. So I did want to bring back, again, exosomes or stem cells on, we've been focusing on sort of the knee, and I asked about the neck and back, etc. What about neurodegenerative? If you could just recap that for us.
Sure. So exosomes delivered intravenously, like you're getting here. The exosomes are so small; they're about 1/1000th the size of a cell. Can travel through the blood-brain barrier. That means they can get through the small capillaries that get into the brain and the nervous system. Stem cells generally cannot. They're large. They're 1,000 times larger. So now people can have benefits from a stem cell IV because those stem cells are producing and delivering exosomes that then can travel through the blood-brain barrier. But so again, we're cutting out the middleman. The delivery of exosomes can get to the brain, and any brain issue that is calling for help with inflammation. So let's talk about diseases of inflammation that affect the brain. Alzheimer's disease has an inflammatory component to these misfolded proteins. You talk about recovery from brain injury. There's an inflammatory component. You talk about MS, multiple sclerosis. There's an inflammatory component around the veins in the brain. So anything with an inflammatory component may benefit from the anti-inflammatory results from a regenerative approach. And that's exactly what we're doing here. We're giving you a big dose of anti-inflammation. And as you know, age is an accumulation of chronic inflammation. So some people call it inflammaging. You may have heard that term. It's a great term.
I wish I would have coined that.
Say trademark. So what we're really doing is slowing the inflammation and thereby slowing the aging process. Even if it relates to a disease that's an age-related disease. And that could be a brain or a neurodegenerative, neuroinflammatory. It could be cardiac, coronary artery disease, clogging of the arteries. There's an inflammatory component. Diabetes, there's an inflammatory component in the pancreas. Inflammatory bowel diseases, autoimmune diseases, these are all inflammatory diseases, may benefit from the anti-inflammatory effects of regenerative medicine, and we're seeing that.
So I'm going to pull on this thread for a second. So you said, okay, Dr. Gross is not giving medical advice, there's no medical advice, and he said may, but my question is there some early science or some early research on whether it be stem cells or exosomes in MS, in some of these, not only neurodegenerative, but just diseases in general?
There are. Most of the work is from Europe and Central America and Asia. There's some here in the States and North America. We're slow here. The funding for research is, pushed into areas of disease and pharmaceutical. You create the scarcity and you create the solution, right? That's how that works.
Yeah. So then, I think you did a good job, Ray, but let me just ask this maybe in a different way. So what is really happening as we age? Inflammation, you kind of said, and then, what can we do to slow it down? And maybe let's expel, I think that the simple answer is, stop inflammation, but let's build on this a little bit.
Okay.
What does it take? I mean, we talk about a bunch of modalities that I do, that you probably do. I got the IV going today. Let's pull on this thread a little bit here for the audience.
No, I like this because it all comes down to what's happening at the cellular level. When you eat your berries and your leafy greens and you feel better, you eat clean and you feel clean. It's happening at the cell, and a number of things are happening, and you got to have a little understanding of the biology, right? You want your cells optimally functioning. And we call that cellular metabolism. What pathways are active? What genes are being used to produce proteins? We're not changing the genes. We're helping influence which genes are being called upon, which genes to be quiet. And this turns into how you repair yourself, how you repair your DNA, how your cells are healthy and not becoming senescent zombie cells where they're just taking up real estate and resources but not producing and not contributing to the community of cells. So you need to get rid of those cells. So that's a process of killing off useless cells. Is called apoptosis. And a lot of nutrients and activities and behaviors and lifestyles that we call epigenetics are really focusing on maintaining your most optimally functioning population of cells and getting rid of the rest. And we do that through diet and sleep and exercise and all these things, supplements, everything.
What would you say is one area where you think it could be on stem cells, exosomes, or just the broader regenerative medicine? They think there's the biggest misconception that people don't understand, the layperson doesn't understand.
I think that people think stem cells are a panacea, a cure-all, and they're not. But they're wonderful and if used properly and strategically with the right know-how. I think that's the first one. Can I do a list?
Yeah, absolutely.
Okay.
I'm going to interject everyone. Maybe not everyone. So basically what I'm hearing, Doctor, you correct me if I'm wrong, I'm hearing Dr. Gross says, if you have the resources, you can't do stem cells every week and smoke and drink like crazy and eat McDonald's every day and blah 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 blah.
Yeah, and that was going to spread into my second
Okay.
response.
Sorry.
That was the perfect segue. We did not prepare that, but we want to put stem cells into an optimized environment. So if you are not doing all the work, the stem cells will be wasting money. They may help some, but they're not going to have as much and as long a benefit. The area under the curve will be much less. I think third, can I jump to third?
Yeah, absolutely.
Okay. I think third is people think they're illegal. They're not illegal. We are not in the States allowed to make claims that stem cells or regenerative biologics cure or treat any disease or condition, which is why we talk about what they may do, how they can assist with your body's healing properties and help your cells in their health. But I can't say anything else. I can show you stories and observations of other patients. I can't say you'll get the same results. And frankly, doctors really don't do that anyway, so it's sort of a silliness, right? We don't guarantee anything anyway.
So let me bring this up. And we have a very diverse audience, and some people are going to be health optimizers or in the medical field. Some are not, and they're watching for interest's sake. But some people might know about a case recently that I think just got thrown out or got overturned against the FDA, where, and I might have some of the details fuzzy, where stem cell procedures where you, let me see if I get this right, where you're culturing them to make them go was halted I think about 5 years ago, and now just recently in the last year that got reversed in California. I'm not mistaken. I think you know the case I'm talking about. Or,
yes. Yeah. So it was at the appellate level, and the appeals court said the particular practice in the company was not violating what they were being accused of. So this may come down to a separate area of regenerative biologics called manipulation. So we do not, and we are not allowed to manipulate a biologic. That means I cannot take these biologics that we get straight from the perinatal source and put them in a petri dish and shine x-rays on them and give them all kinds of crazy nutrients and then give them to you. I cannot manipulate them. They have to be pure, and they have to be used in a homologous way, meaning for the purpose they were originally derived. And that's sort of vague and open, but
if I'm not mistaken, I think it was, again, fact check me on any of this, that taking someone's own either fat stem cells or from bone marrow, and then they
100%.
were manipulating them to expand the culture.
Correct.
That was deemed a drug, and now it fell under FDA approval.
Correct.
Or something like that.
And it's a moving target because they were fat-derived stem cells, and I don't know that they were manipulated, but they were cultured. So they're put in a petri dish and they're allowed to divide and expand so they can get more of them. So the question may be, is that a natural environment, or because it's not in your body, and is that manipulation or not? And I don't really think it is, as long as they're not giving it super nutrients or something. And then the second part of that wasn't just about manipulation, but it was about the use, and they were your own cells. You're not giving them to anyone else. So I think that's a fine practice, but I'm always a proponent of, I'm 57, you're 47 almost. Yeah. I want to be 47, I feel 47, but I don't want to take my 57-year-old stem cells and put them back in me. Like I said earlier, you don't take the oil out of your car when you're changing it, put it back in. Now, if you're smart and young and you're 18, you go have them harvest your stem cells out of fat and you save them, and then years later if you need them, okay, maybe you got some young stuff you can tap into. It's like saving the umbilical cord from the baby in case the baby ever needs a bone marrow transplant. That might be intelligent. But if you're in your middle ages or beyond, listen, get the youthful stuff off the shelf. I'm a little more proponent of that. What the folks are doing at the Stem Cell Surgical Network are fine. I like it. I also am not a big proponent of fat-derived stem cells. Fat, especially in an obese person, has a pro-inflammatory signal. Those cells are bathed in that. The stem cells are in that soup. I don't want inflamed stem cells. I want the youthful, uninflamed, unadulterated, unexposed, pure, right at the time of birth stem cells. I'm a purist.
So you bring up an interesting point. So pros and cons aside of fat derived versus bone marrow, if someone was obese, would that, in your opinion, what I'm hearing you say is that it'd be better for them to get bone marrow, their own bone marrow derived stem cells?
If one were to choose, and I don't know that there's a head-to-head competition, and there are good results from fat-derived stem cells and adipose stromal fractions and things, I get that. I would think the bone marrow is a richer source and a better source all in all. But then you can even take someone with an inflammatory problem, an autoimmune disease, let's say, and their bone marrow's probably got some exposure to it anyway. Another reason why mess around with my old stuff? Give me some of that young stuff.
Yeah, I think, again, I'm not well as versed as you. Obviously, this is your business. But if I think back to maybe 4 or 5 years ago, maybe a little longer, when this is on the forefront, I'm starting to learn about it. It seemed like, from your own fat cells or from your own bone marrow was like the only game in town. That's all anyone talked about. Maybe exosomes and IV, like I'm doing today, was around, but it just wasn't in my sphere. And it seems like it's just so much simpler, right?
It is much simpler. That's exactly right. Which leads me to the next myth. At least here in the States, people think you have to leave the country to get stem cells or exosomes. And here you are,
Here I
in
am.
the U.S., receiving them now.
So, a Canadian in the U.S. getting exosomes done.
Crazy times. The one of the reasons why the places in Central America and Mexico do so well is they've been around longer and they can make any claim they want. And if you go to their website, so we cure this, we cure that, and that's probably why they get more attention.
As an aside, it's probably 2 or 3 years ago, someone, I won't mention his name, probably people know he advertises a lot, from Mexico, did a little tour and came through Calgary where I live, and I went to listen to his talk and all that and all the wonders, and yet you'd think they'd have to be a little bit careful what they said when they're in another jurisdiction, but they were pretty blatant about their curing and this and that. It sounded very interesting, but wasn't for me at the time. But any other myths?
No, but if one comes up, I'll raise my hand.
Okay, awesome. As we sort of kind of come to a close on this portion of our recording, or at least if this is a standalone podcast, I'm going to assume, you said it earlier, that you've done a number of your exosomes yourself, but I'm curious, what else from a longevity, anti-aging, regenerative, whatever terminology you want to use, is your part of your daily practice?
Well, I've got 2 parts to that. Part 1 is what's free or inexpensive. So I think sleep is huge, restorative sleep, and I think that it requires some effort. You should track your sleep. I'm a big fan of trackable tech, wearable tech. You can see I've got a certain brand of watch here. We don't put any plugs until they pay you a royalty for.
Yeah, I have a certain ring that I wear as well, and I always say their name. I probably shouldn't because I don't get any.
Right, and there are new ones coming, and there's another band, and I think you should track your HRV and your sleep. But sleep is huge. We do our repair at night. Secondly, I'm a big fan of supplementation. We just don't get enough stuff from our natural diet, even if you eat great. I think we should also be very conscious about our timing when we eat. We should eat during the light, not during the dark. And going back to supplements, I'm a big believer in replacing and optimizing hormones, including and maybe even especially melatonin. So I say melatonin and my patients say, oh yeah, I'm fine, I can go right to sleep, I don't need melatonin. I say, wait a minute, time out. I used to think the same. But melatonin actually stimulates some cellular activity that helps you do the repair at night. We have a dark phase. Plants have a light phase and a dark phase, so do we. And we really want to take advantage of that dark phase. And the dark phase involves the melatonin as a hormone, and we stop making that after puberty. You ever try to wake up a teenager?
I have a preteen, and it's very tough.
All right, well, they're secreting melatonin. They're hard to wake up. They sleep deeply. So I do believe in melatonin supplementation at nighttime, not to go to sleep necessarily, although it helps, but to sleep deeper and repair your cells. But that's an example. So we got sleep, we got supplementation, we talked about diet, timing, we talked about diet, what kind of diet, and of course we could talk for hours on that. And then there's protein. We do not get enough protein. We are protein animals. We are nitrogen life forms. You hear on Star Trek that we're carbon-based. No, we are nitrogen-based. We have carbon exoskeleton, an internal skeleton too, but we're nitrogen-based. You've got to have protein. We are not getting enough protein. Longevity is based on a couple organs: your bone, because of your bone marrow with your stem cells, your life force, and your muscles. And if you're exercising, which is the next element, and it doesn't have to be tons of exercise, it has to be strategic. It can be interval, it can be some of it heart rate dependent, some of it resistance training. Just be strategic about it. You stimulate your bones, you stimulate your muscles, and the better your muscle mass and the better your bone density, the longer you live. We know that. That's studied. I don't really care too much about cholesterol. If you've seen the recent Scandinavian biomarker study that was published September 19th, which is 3 weeks ago, slightly elevated cholesterol was actually associated with longevity. So
I've not read that one at all.
What we've been fed is, information-wise, was probably incorrect in the past. And a lot of things we learned in med school was not right. For example, probiotics. I believe there's a huge bit of work we can do to suppress the inflammation that we're exposed to in our food and how our gut responds. Our gut is basically the skin on the inside that deals with food and nutrients and what we eat, what we ingest. And that might be more inflaming than what touches our skin or what we breathe in our lungs. So, I'm a big fan of probiotics. They didn't even cover that med school. And then those are the easy and inexpensive things you can do. And then on the...
So those are the things you do as well. That was the
I
question.
do these things.
Okay.
Yeah, what's the question? I do those things. Am I perfect? No, I have some weeks that get crazy and I don't exercise enough, or I'm not. Yes, I had dessert once today, of course. But then you make up
Or
for
you
it.
get stuck at the airport waiting for your luggage and you got to eat a bar.
A bar's, an energy bar, if it's a good one, not bad. I'm very sugar conscious. I'd much rather have some meat or bacon or something, or jerky, than a sugar treat. Okay, so on the other side of things, I'm becoming a bigger fan of senolytics like rapamycin, and I have done rapamycin, and I will probably do multiple courses of it. And these are...
Okay, that's our round 3 then. Round 3 of the podcast.
Yeah, we'll come back to it then. So these are pharmaceuticals that are being repurposed because they are shown to be associated with longevity. So looking at things like that strategically, and I do the regeneratives, which is probably, off the beaten path like you're doing now. You're in my club.
Yeah. How about, just going off on a tangent for a second, just because you brought up rapamycin, what about metformin for a non-diabetic?
I did metformin for anti-aging purposes to reduce my overall exposure to sugar. So I've gone on and I've gone off it. I'm a fan. You have to make it work for you. I've also used peptides. One peptide in particular, semaglutide, instead of metformin. So you can do one or the other. I don't think I do both at the same time.
Yeah. Very cool. Anything else?
There's a lot, but I think we'll have to spill over into another.
Absolutely. I think we'll definitely do it. So I want to share, you do have a gift for the listeners, a free resource. We'll put the link in the show notes. This is a ebook or?
We have, I think it's an anti-aging guide to supplements.
Oh, okay.
But as an added benefit, if you act now and you mention Deepak's podcast by name when you call, I will do a free phone consultation with you or Zoom consultation.
Yeah, you gotta take that up. You gotta take that up, everyone. So the link is Young Again Method /longevity for this free resource, and then generous offer by Dr. Gross here. Mention the podcast when you call in and get a free phone consult. As we wrap up here, round 1, and I'm going to hold you to round 2, at least a round 2 at some point. And I would love for it to be in person. Maybe it'll have to be virtual. But any last words of what I got? Oh, my bag's almost done too. or maybe it is 10. Any last words or wisdom or tidbits or golden nuggets for the audience?
Start early. I obviously need some exosomes, and add something every day, and make it doable, make it simple to achieve it. But start early. Early you start, the more health span within your longevity you can achieve, and it would not be crazy for us all to be centenarians and beyond.
Well, everyone already knows that's what I'm planning to be. I'm planning to be a centenarian plus. Thank you very much, my friend. Appreciate it. I'm going to throw it back to Jxxiii. Jxxiii is going to carry us out with some music here. Thank you again for listening to the Deepak Saini Show, and don't forget, exceptional results for the exceptional you. Until next time. This episode is brought to you by Optimizers Magnesium Breakthrough. This is a product I've been using and our family's been using for 4 years already. What I love about it, it has 7 different forms of magnesium in it, all the forms that your body needs for all 400 processes that your body needs magnesium for. Most magnesium supplements have 1 form and usually a crummy form of magnesium. This has all 7 forms that your body needs. So click the link and get at least 10% off. Sometimes there's specials and you even get more. So check out Optimizers Magnesium Breakthrough.
Podcast produced by the Minted Green Company.